the upper left, the medial superior corner of the scapula. So I'm going to brace him like this and round rub down the medial border of the scapula. Just watch now, you don't have to do it yet. Okay, then starting in the same place, I'm going to head north towards the occiput. If you think you're going to kind of like scringe with their hair, use their collar if they have one. It's a super handy thing. Okay, I'm going to find small intestine 11, which involves taking not my working hand, but the opposite hand. This middle finger goes along the medial border of the scapula. This goes along the bottom border, the inferior border, if you will, and then where my index finger stretches in between, that's SI11, roughly. That at least gets you in the right area. Then you have to feel around a little until you can figure out where it's going. You can also brace here.
You just do the point, right?
Yep. Debbie, is that okay? What are you feeling? You can say nothing if it's nothing.
Yeah, just a little bit of pressure.
Okay. Then I want to take his arm and keep it as loose as possible. I do a lot of this kind of jostling. And we're going to pluck back here. I'm going to switch hands so I can easily pluck in the front. All right, put that in his lap. What muscle am I working on here?
Deltoid.
Thank you. Am I working on the triceps?
No.
Not really, which is why I'm not going down here and posterior, right? So really more lateral. But they're different parts of the deltoid. Okay.
Oh, then you go posterior, right?
Yeah,
A little bit.
yeah, exactly. So we end up covering the whole arm. That's right. And not just the deltoid, the biceps, the triceps, but this wonderful little muscle, the brachialis, which sits underneath the biceps.
Okay.
So as I'm going to come straight for this. I'm going to squeeze the bottom of the biceps, and where my thumb lands, and I start to feel bone, that's basically brachialis. It's going to be kind of a sore sensation. So in order to easily find it on the other side, I do the same thing with the other hand. Okay, so notice at this point I'm kneeling because I'm going to work on the lower arm. So we're doing more of this grasping. Do you remember how in front of legs we did sinew dividing? So same kind of thing between the radius and the ulna. This is the lateral part of the arm. I know that's more or less these are the two bones. I'm going to go in between them. This is roughly equivalent to the Sanjiao channel, if that means anything to you. If it doesn't, it will eventually. Yes, and that's yin and yang. Okay, then I'm wiping. Inside of the arm. Going to continue down onto the palm. So we get the thenar eminence, you all know from the lung channel. It's going to be super sore on some folks. On Velveeta is just super well developed.
Maybe it's a little bit of both.
Yes, okay, fine. And then the hypothenar eminence. Okay, and then we can wipe the dorsum. Then this is where you do need to ask female patients,
Is the person?
are you pregnant or not? So you're going to dig into LI4. But quite honestly, since we don't know everything, you should ask all your patients. Sometimes we don't know. Are they transitioning? You know, it's... Okay. Then we're doing a foulage version on all of the fingers. I'm not just starting here where the finger is obvious, but way up here. In the metacarpals. So if, ladies, if you're wearing jewelry, this is probably a good time to take it off. Because the practitioner needs to be able to work on you without worrying whether it's going to hurt you. Then foulaging 3 times.